This is now our third virtual session for our dialogues on aging. We are all adjusting and really happy to be connecting in this new way. And it's really quite delightful that we are able to connect with a number of you from across Canada too. So welcome Montreal, Ottawa, some from Saskatchewan and Alberta. So really delighted to have you here with us today. As usual, we start our session with some wise words and new ideas from our exhibitors, and we will do that. In a moment. Today, ending the exhibitor session, we're going to have a delightful piece of music to share with you as well, and then we'll move into having our presentation in the second half by Dr. Julie Robillard. So let us begin now with our presentation by Carla Busnardo, President of the Soroptimist International Vancouver, and Janet Law, who is the incoming board member for the club. They will provide us with the highlights of their work in the city of Vancouver and the Lower Mainland, and I think really key, how their members are staying connected and continue to carry out their services during COVID-19. So over to you, Carla and Janet. Thank you.
Hello again, I'm Carla Busnardo. I'm the current president of Soroptimist International of Vancouver. I've been a member since 1991. And I've told many people I would have done this 10 years prior had I known what this group was all about. So Janet and I are going to take you through just a few key points, and hopefully you'll have some great questions for us at the end. So to start with a little bit of history, Soroptimist was formed in 1921 in Oakland, California, at a time when women were not permitted to join service organizations. Our name, loosely translated from Latin, means the best for women. Today, we have about 160,000 members in 21 countries and territories. We belong to one of 5 federations that make up Soroptimist International, which has clubs in more than 120 countries throughout the world. Since 1926, Soroptimist International of Vancouver has been committed to improving the lives of women and girls locally and internationally. We have started the preparation for our 100th anniversary and are seeking out the descendants of the charter members of our club so that we can recognize their contributions. We are also looking for past award winners and those whose lives have been touched by the organization so that we can celebrate together. Recognize, rejoice, and remember. So mark the date in your calendars to attend our celebration in April of 2026.
We're going to make sure that you mark that on your calendar. We hope you'll all be there. My name is Janet Law, and I have been a member of Soroptimist for about 2 years in Vancouver. Although I did know about the club many years before that, it took me time to finally become a member, and I'm so glad I did. So I want to share a couple things with you. First off, using a 3-pronged approach, awareness, advocacy, and action, Soroptimists always identify the needs of the community. Be it in a big industrial city or a small rural town, Soroptimists then establish projects that best address the need of that community. Well, here in Vancouver, housing has been identified as one of the greatest needs, and it still is today. The club has procured buildings and land that has contributed to seniors' housing and safe homes for women. Today, we currently own 1 apartment complex at Cambie and 13th and share ownership of one at Cambie and Marine Drive in the city of Vancouver. Our big news project is the redevelopment of our 21-suite apartment building on 13th. This will be turned into a 164-suite tower, which will house women of all ages and from all walks of life that share a common need, affordable housing. We also know that our need as well is for diversity. And so all of those women will be coming from varied backgrounds and perspectives so that they can all work together to improve their lives as women. We also have an annual awards program, and we distribute between $10,000 and $20,000 a year. This year, Soroptimist International of Vancouver awarded over $14,000 to young leaders, nursing students, and to women who provide the primary financial support for their families.
And congratulations to all the people that are doing all of this via Zoom meetings and phone calls, and all the judges and even the award recipients this year. We couldn't have our annual awards event, which is our major fundraiser. So we had to do things a little bit differently, and everyone's been so flexible and supportive. It's just been, it's a great community to belong to. So our club, all clubs are dues supported. So we're dues supported club focusing first on a local need. We've supported grassroots organizations all over the Lower Mainland, literacy programs in elementary schools. We've supported seniors, youth, and of course, women of all ages and all levels of need. We're part of the Western Canada region of clubs that cover our first 4 provinces, or our Western provinces. There's 13 clubs in British Columbia, 9 of which are in the Lower Mainland. If you were to join a club, it can be in the community that you live in, the community that you work in, or the community that you most want to support. You're not tied down to an address. My contact information is at the end of the presentation so that I can help you get to the community you most want to support. So in addition to our commitment to the community, Soroptimists work for change at national and international levels to improve the quality of life for people throughout the world. We are part of a global organization and are blessed to have a seat at the United Nations.
We also know that a Soroptimist is a leader in her community. She believes that by joining with other women and engaging in awareness, advocacy, and action, that the service in her community and society will make the world a better place for all. Soroptimist equals women at their best, working to help other women be their best.
So thank you very much for listening to our presentation, and we're here to answer any questions that you might have.
I understand that your housing project is going to be supported entirely by women architects, designers, the carpenters, etc., etc. Would you like to add more to that than I have?
I'll jump in. We are trying our best. That is our focus, to ensure that the majority of every part, our architectural company right now is a women-based company. And so part of our mandate in all of the calls to bid on any of the portions, we're going to be looking at doing the best we can to have women building that complex for women.
We encourage all of you as well that anyone is invited to come to one of our meetings, to see what we do, and we are open and receptive to anyone who would like to come and check us out. So I hope that some of you will consider that.
And we're going to welcome Jennifer Anyegah, who is an audiologist. And there's Jennifer right there.
Great, thank you.
Go.
I am pleased to see you all today. Well, I guess I can't really see you, but I'm pleased to be here today. And we're just so used to saying things like that. And to be speaking with you today as part of a series. And today, my name is Jennifer Anyegah. I'm a doctor of audiology, and I am the regional director for Connect Hearing in the BC mainland. And I'd like to share with you today what I call staying connected, and I'll be sharing with you some communication tips for staying connected during this COVID time. We have at Connect Hearing, we have over 140 clinics across Canada in most provinces except New Brunswick, Quebec, and Newfoundland. We're in most provinces, and we have 37 clinics in the BC mainland area and in the interior, as well as 18 clinics on the island. So before I start, I do want to share that when it comes to hearing and hearing loss, the most effective way to deal with hearing loss is really to treat it. It's very difficult to take action about hearing loss when you have it, except to treat it. And for the most part, depending on the type of hearing loss that you have, hearing aids do tend to be the best intervention for that. However, if having a hearing test and a hearing assessment is not really in the cards for you at this time, I know most clinics, not just ours, but most clinics are open for appointment-based, similar to physiotherapy and dental appointments. Most clinics are open at this time, but I thought I would share some general communication tips that would be helpful. I call it COVID communication tips. One of the first questions I have for you is, are you a lip reader? And most of the time I have clients tell me that they are not. Oh, Jen, I can't lip read. I just, it's not something I've ever learned to do. And well, I have some news. We all are. We are all lip readers because our brains take whatever information they can get with whatever senses we have going for us to make to decipher a message. So whether it's hearing with our ears or hearing with our eyes, we definitely all do a certain amount of lip reading. So with this in mind, I have some considerations that you might think about when you're trying to communicate, or if you're having difficulty communicating at home. So one of the things is proximity. Of course, I know everybody's experienced this, well, how am I supposed to hear my husband when he's talking to me from another room? Or I can't hear my kids when they're talking upstairs, downstairs. Of course, proximity makes a big difference. It's kind of a no-brainer because, obviously when we're trying to communicate and hear a signal, the closer it is, the more likely we're going to hear it. And so that is something to take into consideration. If you are living with someone with a hearing loss and you want them to hear you when you're talking to them from another room, you may just want to get closer or get to that room. Or if you are the person with hearing loss and you're calling out to someone and expecting to hear them, you might just want to be the one to get a little closer to that person. And this also aids with that whole piece on lip reading, that when you can see someone's face, you have a much better chance of hearing what they say. Lighting, here's another one. Sometimes maybe we're, maybe we're just starting to get out again to restaurants, or where the lighting may be dim, or there may be background noise. If there's any background noise, having good lighting to see the whole face, this is going to be really important for lip reading and for communication and understanding what someone's saying. Now, the other piece I have here, number 3, is signal. What is the signal that you are trying to hear? First of all, we talk about voices, and one of the reasons proximity matters is that, the sounds of speech are, some of them are low pitches, some of them are high pitches or high frequencies. High frequencies tend to be consonant sounds. And the consonant sounds are the sounds that actually make the words make sense. Vowel sounds tend to be more low frequency. Now, consonant sounds and high frequencies, they don't travel well around corners. So that's why they use a low frequency sound like a foghorn when they're trying to, make a signal on the water, because it travels far. So this is part of the reason that proximity is important. And when we talk about hearing on the television or even on a computer, what we really need to think about is how far away is that signal to me? When we are in conversation with each other, we tend to be, 3 or 4 feet away from each other. Well, as long as we're in our little bubble, I guess. But maybe we're further away than we used to be. However, we tend to be a lot closer than, say, the TV. And some TVs don't have very good speakers. Some TVs, the speakers are actually in the back pointing towards the wall. You might have a big room if you have a grand room, and the sound is kind of bouncing and echoing everywhere. So this is one of the reasons why people have difficulty hearing the television, and that is just because the signal sort of dissipates as it comes out of the TV and reaches your ears. So actually the best way to hear on the television or even on your computer is to use a set of headphones like I'm using, because then you get the voice right here. And you can pick up wireless headsets at Best Buy. You can order them on Amazon or whatever that is. And hearing aids these days all come with Bluetooth devices that you can plug into the TV and get the TV right into your ears. So best way to hear the TV or any kind of distant signal. Now the last tip I have here, I do believe it's the last tip, is just attention. When we want someone to hear us, it's a very simple tip. We should call their name first. We should say, hello, Barbara, if somebody's in another room, yes. And then when we have that person's attention, even if they don't move to our room, they're much more likely to hear what we're saying if we called their attention first. So this is one of the tips I often give clients, spouses, people who are living in the same house. Just get their attention first, because we might be cooking, we might be watching TV, there are dishwashers going, background noise. Somebody has a lot more potential to hear you if you get their attention first, and that can also dissipate a lot of frustration. So that's what I have for you today, and I do welcome any questions that anybody has on these pieces that I've shared.
Jennifer, I know our audience is quite a varied group in age. Is there a particular age that you recommend beginning to get hearing testing?
We do recommend that you have a hearing test over the age of 50. Yeah, just as a general health, as part of your overall health. And that's because hearing loss is something that's very insidious. It's hearing loss due to aging anyway is very insidious, happens very slowly over the years. So, and the other piece is that it could be linked to other health conditions such as diabetes, any kind of heart conditions, cardiovascular disease. So it is a good idea over the age of 50, just have a baseline to know where you're sitting.
Okay, thanks for that.
I have a question, Christine.
Sure.
Okay.
Hi, so we're talking about lip reading, and we're all lip readers, Jennifer. In this time where we're supposed to be wearing masks, do you have any tips on how to communicate when you have a mask?
Yeah, wow, it's very challenging. I know even for our offices, we were hoping or looking into getting those masks with the, with the plastic piece in them, or a little face guard, or just having plexiglass. I know a lot of our offices, that's what we're doing so that our clients can hear us better, because the mask, not only does it cover your lips, it's harder to hear me that way, but it also muffles your voice. So it's a good question. I don't really have any good answers for it, although I think I hope people are becoming more patient, because even us with normal hearing, we know we're not hearing the cashier, or we're just kind of nodding, making assumptions about what people are saying behind their masks.
And that question came up twice in the chat, so that's a common question. We have another one here from Teresa. What about people with hearing loss using cell phones? Can you recommend one for someone who has cognitive impairment and reduced hand dexterity?
I'm not exactly clear what the question is. Is it,
Teresa, I'm going to unmute you
Yep.
here.
Oh, can you hear me?
Yes.
yes.
Oh yeah. So I'm working with a client who has she sort of has a cell phone with larger buttons, but when she holds the phone to her ear, the people on the other line can't hear her, and then when she moves the phone down to her mouth, she can't hear what they're saying, and she has quite severe hearing loss. So I'm not, yeah, and she doesn't wear any hearing aids.
Oh, okay. Okay. That was my next question. Does she wear hearing aids are, well, the benefit of hearing aids nowadays is that they actually connect Bluetooth directly to the phone. So somebody can be talking on their phone and actually the voice is going to both ears, which is always better to have sound in both ears. But then the other piece is it is also very difficult to hear on the phone because of this whole piece. They don't see the person, and anybody with a severe hearing loss is automatically doing a lot of lip reading. And if they don't see someone, that they're not going to hear very well on the phone. So actually a cell phone with the possibility of FaceTime and something, a visual is the best scenario for someone like that.
Maybe like a cell phone with headphones. Would that be better even?
Yes. Yeah.
Okay.
Depending on the hearing loss, and if she's not wearing hearing aids, a cell phone with even a set of headphones like this that you can adjust the volume, or even a set of headphones like that plugged into the jack, it's going to help a lot more, having the signal in both ears.
Perfect. Okay, thanks so much, everyone. So my name is Avery. I'm the Provincial Coordinator for Knowledge Mobilization at the Alzheimer's Society of BC. So thanks so much for having me here today. Thank you to the previous presenters who have shared the important work you're doing. I learned a lot there, so thank you. We're a charitable organization that supports all British Columbians who are connected to dementia in some way. And even though our in-person programming is temporarily suspended due to the pandemic, I want to share some of our supports we have that you might be interested in, as well as a few healthy living tips. So all the information I share will be sent to you after the presentation, including links that you can check out. And some of the information I'm about to share will be part of our dementia wheel game afterwards, so I encourage you to listen closely. First off, I wanted to mention our First Link Dementia Helpline. That is what you can see on the screen currently. All of our numbers and information is there. So we really encourage you to use this helpline. Give us a call if you have any questions about Alzheimer's disease or other dementias. If you're looking for information, if you're looking for support, this is great for caregivers, people living with dementia, healthcare providers, and members of the general public. Anyone can call our First Link Dementia Helpline. And we have service in English, as well as Mandarin and Cantonese, and a Punjabi line as well. We've really been focusing on increasing our First Link calls to stay in touch with families and continue to provide support at this time. Also, we have weekly webinars. They're generally on Wednesdays at 2 p.m. So you'll get a link so you can check out the website and see everything that's coming up. And then we also have our newsletters, Insight and Connections. Our spring edition is out now, and we're busy working on the summer edition that will be out early next month. So I wanted to share a few tips for brain health and healthy aging. Research has found that one's lifestyle can influence their risk of developing Alzheimer's and other dementias. So I just wanted to share our top 3 healthy living tips. Our first tip is that we encourage you to be physically active. That ties into the speaker, Dr. Puderman, that we had last 2 weeks ago. So we recommend you find an activity you enjoy, whether it's walking, yoga, Tai Chi, or seated exercises. We recommend you aim for at least 150 minutes per week in sessions of 10 minutes or more at a time. And ideally, you should aim for a mix of aerobic exercises. So that's cardiovascular activities like walking, dancing, or running, as well as resistance training. So that's using things like weights or resistance bands. So we dive deeper into the research behind exercise and dementia, and we feature exercise tips in the spring editions of Connections and Insight, which are out now. And then for our second tip, we recommend that you find ways to challenge your mind and learn new things. So last week we had a webinar with a researcher named Nathan Lewis from the University of Victoria, and he talked about the research on cognitively stimulating activities and how they can be protective for your brain. So he recommended choosing activities that are multisensory, so they involve coordination between different regions of your brain. That could be things like playing a sport, dynamic activities, so that's where you have to kind of think on your feet, react quickly. So that could be, for example, reading sheet music while you're singing. That's a really great activity, as well as social activities. So doing things with other people, that's great for your brain. So maybe doing a puzzle together, practicing a new language together, that sort of thing. And then choosing activities that you enjoy. So, you'll put the most effort into things you enjoy, so find what works for you. The mentally stimulating activities you might want to try include reading, puzzles, playing music, sports, learning a new language, or trying a new hobby like knitting. So that webinar is available on our YouTube page, and I'll have a link for you if you want to check it out. And then our third tip, and this is especially important right now, and that's to reduce stress where you can. So research has shown that if you're stressed for a long period of time, it can cause changes to your brain and body. So there's really a stress hormone called cortisol that they've done a lot of research on. And it's particularly important during the pandemic, of course, which many Canadians and many families we're connected with are finding very stressful. It's important to find time to connect with family and friends, or our First Link Dementia helpline can be a support for you. For caregivers, planning those physical breaks and respite time is really important. Reaching out to your networks and seeing where you can find support. And also avoiding information overload. So for example, I try to schedule certain times of day to look at the news, consume that sort of content, and then I try and take a break. You might also wish to try some relaxation techniques like meditation, which there's a few great apps you can download on your phone, or visualization, which is, taking a moment to imagine a space that you find calming and soothing. We cover some of these stress-busting tips and resources in more detail in the upcoming summer edition of Connections. So if you subscribe now with the link you'll get after this presentation, you can receive it when it's released early next month. So that concludes the information sharing part of my presentation today. I think we're all focused on the wheel here. I know it's a great eye-catching thing here. So we take this wheel to different events in the community. We've taken it to the PNE, Canucks games. So the game is to test your dementia IQ. So each number here corresponds to a question. And so if you'd like to volunteer, I'll spin the wheel for you. We'll see what number it lands on, and then I'll read you a question and you can win some prizes. We have our brain stress ball, which I've been finding very helpful. We have some pens, you can never have too many pens, as well as our forget-me-not pins, which you can see here that I'm wearing today. So if anyone would like to volunteer, feel free to type in the chat box or unmute yourself, and Christine will let me know, and then we can spin the wheel. So thank you so much.
Yolanta.
Perfect. Okay, I will give it a spin for you. Okay, question 5. And I'll note I changed all the questions, so if you've been here before, you don't have an advantage. Okay, so this is a multiple choice question. Which of the following are signs of dementia? A, forgetfulness. B, trouble finding the words you want to use. C, wearing inappropriate clothes for the weather. So for example, a heavy coat on a summer day. Or D, all of the above.
Yeah,
so
the words, forgetful words.
Forgetting words is one example. Yeah, and then, so it's actually all of the above, because there's also trouble finding the words you want to use, and C, wearing inappropriate clothes for the weather. So when someone's wearing a heavy coat and it's summer outside.
So maybe both of them.
Exactly. Yes, both of them.
Yeah.
Perfect. Yeah, you got that one right. Yeah. So a lot of times we just think about forgetfulness, but there can be some different signs of dementia. So that's things like problems with language, personality, mood changes, disorientation in time and space. So perfect, Yolanta. Thank you so much for participating.
There. Yes, Hyro.
Perfect. Okay, I'll give it a spin.
Thank you. Number 7, hopefully. No, I'm kidding.
Number 2. Okay.
Right.
So this one is a true or false question. So true or false, dementia is a disease that only affects older adults.
That's false.
Correct. Yes. So dementia can affect adults in their 60s, 50s, even 40s. And when someone's diagnosed with dementia before age 65, it's generally called young onset dementia. So that is correct. Thank you for participating.
Thank you.
Thank you.
Be in touch to get your contact details after the fact offline, and Avery and the Alzheimer's Society will be sending out the prizes actually from all 3 events. I know some are waiting eagerly, so they're looking forward to that little special delivery.
Yeah, you'll get a little surprise in your mail, which is always fun to look forward to.
Awesome. Well, thank you very much, Avery, and a special thank you to the Alzheimer's Society for sponsoring this spring series and being our partner in this throughout. So we're very grateful for that. And at this time, I'm going to bring us back to Mary Lou Harrigan. We have a little bit of something that we thought would be uplifting and inspiring to share. So Mary Lou, we'll have you come back.
Thank you, everyone. Enjoy the rest of your day.
Thank you, Avery. Thank you, everyone. So we have a few moments left, and we would like to share really a very inspiring piece of music. And we'll just go into it right away, and then we'll have some comments after. So let's have the video up now, please.
From coast to coast to coast, we have seen one thing stand strong during the pandemic, the Canadian spirit of togetherness. It's our first responders, our healthcare workers, essential workers, neighbors helping neighbors, and it's in you. To celebrate the spirit, I would like to invite you to stand and join in singing "O Canada" alongside a very special group of people. Voices in Motion is a joyful choir that brings people living with dementia, their caregivers, high school students, and community members together to share in the love of music. This multi-generational choir was funded as a part of a research project at the University of Victoria, and members are dedicated to reducing stigma, combating social isolation, and having fun. Voices in Motion is a supportive community full of love, connection, and sense of family. Please welcome from their living rooms, Voices in Motion.
I will mention that we have the wonderful good news to share with you that we are planning another virtual series for the fall, probably beginning in September. This was a trial run for us, and we're all finding that it is a really great way to stay connected when we can't be together in person. And so we were looking forward to that in the fall. And one of the things we will include is a conversation of music, and the researcher who supported and did really important research in showing the benefits of this particular choir coming together with persons with dementia, their caregivers, and youth, how that all came to be, and the wonderful benefits of music actually for all of us. So that's one of our topics for the fall. We'll also be updating you on COVID-19 in general. We're looking to have some with some of our experts in that area and chat with you, and continue with other healthy aging topics. So in the meantime, you're welcome to send us any particular topic that you find to be engaging and or important for you at this time.
And Mary Lou, just while we're waiting for the hands to come up, we've had some comments in the chat here. One reads, grateful for uplifting and intergenerational voices. Technology is helping us communicate in many ways. Another says the singing was inspirational. And we have a great question here. Is anyone starting a choral group in Vancouver? When we had planned our original March 27th event, we actually did have a group from North Vancouver that operates out of Parkgate Seniors Centre and with the school, with the high school over on the North Shore, and they had planned to be with us at the Trade and Convention Centre. So we do hope to be able to bring them back together. And there was also a multicultural choral group kind of along the same lines that has started in Burnaby. So we can certainly put some connections in our resource list to those. Any more questions? Jairo, yes. Let me just unmute you. There you go. You just need to unmute yourself. There you go.
Yeah, thank you very much for the opportunity. Well, very quick, maybe, I don't know if this is the place to ask for this, but I was volunteer to support senior citizens. And because the well-known situation we are living in, I'm not able to do it. So I would like to know how to get involved in any way to support senior citizens, because it's something I really enjoy and I would like to keep doing.
I wonder, Mary Lou, if the best way might be for us just to address that with some links in our resources, unless you have any other ideas.
Yeah, no, I think that's a great idea, Christine. We can just provide that information with some links, and then when we do have a session that really will speak more, in depth about music and about choirs in the vicinity and the different types of choirs. But in the meantime, let's send those links. And the other thing that I'm reminded of, I had just a kind of a lovely flashback to maybe about 3 years ago in one of our in-person dialogue on aging. We had a music therapist who was talking about music at the session and all the benefits of that. And then before the session was over, she had the group amazingly come together in a song, and did a fabulous rendition of I think, "You Are My Sunshine," and at the end of that, the group was so really quite inspired and enjoyed, and they said, well, we should be making our dialogue on aging choir. So there is something about music that is wonderful, and if you have a choir leader that just has the wonderful talented skills of bringing people together. So let's leave it at that, and we'll look forward to more discussions on music when we meet again, probably September, but we haven't got the dates finalized, but we'll keep you updated on that. So over to you, Christine. Thank you.
Wonderful. Thank you, Mary Lou. So just a couple of comments for those of you who are interested. We do have recordings of all of the videos are now up on the website, along with all of the resource materials for all 3 sessions. So those are available to you and you're welcome to share. And I did want to give a note that Mary Lou mentioned we received funding to continue the series into the fall. So that's courtesy of the federal government's Emergency Community Assistance Fund. So we're really grateful. We know that the technology isn't perfect for everyone, and it was just the one way that you actually told us through your feedback to the survey that this would be helpful for some of you. So we're glad to be able to continue that on into the fall.
Hello, everyone. My name is Sutinder Kava, and I'm the Interim Program Director for the Elder Care Program at Providence Health in Vancouver, British Columbia. I'm delighted to welcome you all to Providence Healthcare's 3rd virtual Dialogue on Aging in the 2020 series. All of us, of course, are adapting to new ways of communicating during this very challenging time of the COVID-19 pandemic, including distancing and social isolation. We are pleased to be able to create virtual learning connections until a time when we can meet again in person. And I'm delighted that all of you from across British Columbia and as far as Montreal and Ottawa could join us today. Topics today include ones that you have informed us are especially relevant to you during these times. As always, our Dialogue on Aging continues to bring together researchers, clinicians, and other experts on a wide range of healthy aging topics. Our session today continues to meet these goals and is led by Dr. Julie Robillard, researcher from the University of British Columbia. I am now pleased to introduce Maria Howard. Maria is the CEO of the Alzheimer Society of British Columbia and our partner in this virtual series. Maria will now moderate the session.
Good afternoon, everyone, and thank you so much for joining us again for the 3rd session of this virtual Dialogue on Aging. It's been such a great pleasure for the Alzheimer Society of BC to partner with Providence Healthcare. And as Christine said a few minutes ago, I think we are learning lots of new information, but also having some funny technology experiences, which just shows that we're human and we have to smile sometimes. I'm really excited today to be speaking in advance of Dr. Julie Robillard. Julie is a very special person to the Alzheimer Society of BC. She has helped us in so many ways in learning about the services that we provide and helping us look at that through the lens of research. The Alzheimer Society of BC's vision is a world without dementia, and that begins with a world where people are felt included, acknowledged, and felt valued for what they can still contribute. In BC, we know there are still around 70,000 people with a diagnosis of dementia, and that's probably on the low side because we know still so many people are hesitant to come forward and get the support and the diagnosis that they need. The Alzheimer's Society of BC is trying to change that and work with many people in the community and partners. And we're doing that through 5 different ways. We're first trying to change the conversation, which is exactly one of the things we're doing here today. We're encouraging people to keep talking about dementia, understanding about that, let people know that it is a tough journey, but there are many, many good parts of it too. And by learning more and talking more, people know that they do not need to be alone on this journey. We're trying to change the experience and ensure that families and people living with dementia have the support around them. They have programs to go to, they have workshops that provide education, they have support groups, they have exercise programs, they have places where they can still feel they can go, be part of a community and contribute. We want to change policy. We want to ensure that the government, whether it's national or provincial or even municipal, also have the right rules and bylaws and policies in place to, again, support families living with dementia, to make it as easy as possible to navigate and maneuver so many administrative things that happen when you're trying to manage a chronic disease. We're also trying to change practice so that we know that many people living in long-term care live with the diagnosis of dementia. So how do we help healthcare providers support those people living with dementia in a long-term care home, which is their home, and have the best experience for both of them? And finally, we want to change the future. We want to help research, like Julie will be talking about today, to help move forward to one day find the cure, the reason for why dementia happens, but also there are so many other things that we need to learn about supporting people with dementia, and that comes in many different ways of research. And that's one of the things we're going to hear from Julie today. As I said earlier, it's my real pleasure to introduce Dr. Julie Robillard. She has a really long list of credentials. Most notably, she's an assistant professor in neurology at the University of UBC. She is a scientist for patient experience at the BC Children's and Women's Hospital. And she is also a director of the NEST Lab, Neuroscience, Engagement, Smart Technology. Julie also holds another very, very important role, which I think she's been in the role maybe a year. Julie can correct me if I'm wrong there, but she is the chair of the Ethical, Legal, and Social Impact Committee for the CCNA. And CCNA is the Canadian Consortium on Neurodegeneration in Aging, which is a very important national committee that comes out of government, which really is focusing on aging and many of the impacts of it. And to have Julie sitting in that chair role really is very meaningful. Today, she's going to talk about her passion with helping people in aging through the use of technology. It's one of the things that Julie really shines for. And she has some amazing ideas and tips. She also has some really creative ways to approach things, which really I find really every time I hear her talk, I learn something new and I get pretty jazzed about things. She also is very knowledgeable in the world of dementia and how it all interrelates. So I know it will be a very good presentation over the next 40 minutes. We're going to ask that people hold their questions. At the end, we will open up the chat, or you can raise your hand. I know Julie will be great at answering your questions, but we will ask that you hold them till the end. So over to you, Julie, and thanks for being here.
Thank you. So I'm just going to double check that I'm unmuted and that you can see my slides. Excellent. Okay, well, thank you so much, Maria, for this very kind introduction. I'm also grateful to the organizers of the Geriatric Services Conference and this virtual series. It's really a tremendous opportunity for us to connect with all of you. And they've been so patient with me and all my technology related difficulties in setting this up. So I'm very grateful. I'm very happy to be here with you today to talk to you about technology. So without further ado, I'm going to, there we go. Okay. I want to start with some acknowledgements. It's important for me to do that first. First, I'd like to thank all of our research participants who engage with us in our various studies, but also our research advisors. And then my lab, as Maria mentioned, is called the Neuroscience Engagement and Smart Tech Lab, which is a mouthful, so we call it the NEST. Our research advisors are called the League for the Lived Experience Expert Group, and they provide us with invaluable insights about the work that we're doing and how to move that forward. So we're very grateful to them and their engagement around the work that we do. I'm also surrounded by an exceptional team of trainees who are so kind and so smart. It is a pleasure to work with them. For the work that I'll present today, I want to especially thank Mallory Tam, Kat Kabachinska, and Julia Wu, who really helped me with the infographic that I'll share with you in the second half of the presentation. I'm grateful to collaborators around the world, in particular for this work, Dr. Jessie Hoey out of Waterloo. And of course, I'm very grateful to the generous organizations that fund our work, the Alzheimer's Society of British Columbia, as Maria mentioned, but also for the work I'll be presenting on social robotics, AgeWell, and the Canadian Consortium for Neurodegeneration and Aging specifically. So the NEST, the Neuroscience Engagement and Smart Tech Lab, I'll just give you just a brief overview of what we're interested in and what we do. So we're essentially interested in technology in carrying out two goals. The first goal is to effectively measure patient experience. So we want to use technology to better understand what it's like to experience dementia, to experience being a caregiver. We're also interested in other brain health conditions. So there are various ways we can do that and capture really meaningful information and data about what that's like. And the goal of that is, of course, to turn that on its head and use technology then to improve those experiences, improve quality of life, and ensure that people are living their best life, even in the face of challenges related to brain health. And so that's what we're interested in. We look at a variety of technologies today. We'll talk about a whole range of different things: mobile apps, e-health websites, social robots. So we're very inclusive that way, and we're also interested in a range of brain health conditions. So I want to start with a disclaimer. This is a presentation about technology. There's a lot of different technologies out there, and I'll be showing you some examples, and we'll talk about some devices that you may have, that you may be thinking about getting, or that are way futuristic and down the line. But regardless, I want to make it clear that any commercial device that I'm showing you in the context of this presentation is purely as an example, and our lab doesn't promote or endorse any one solution. And where we partner with companies to study devices and solutions, I will mention it clearly at that time during the presentation. But otherwise, anything I show you, any picture I show you is not endorsed or promoted in any way. It's just used as an example to tackle this discussion. So let's start with the various ways in which technology can help with our day-to-day life. I have two slides of examples for you. Some of these you may be familiar with, and some of these may be new to you. On this slide, on the top left corner, we have devices like smart clocks or smart mirrors now, which are increasingly popular. These can help us with a variety of reminders and tips and advice for our day-to-day, and they're quite useful. A lot of people already have them in their homes. On the top right, we have sleep monitoring systems. Some of you may be wearing a Fitbit or a similar tracking device that also potentially tracks the quality and quantity of your sleep. There's sort of sleep specific devices one can get. There's mats you can put underneath your mattress that track similar metrics: sleep quantity and quality, and time spent up and things like that. Bottom left is the Philips Lifeline device, I believe, which is an alert that you can press if you've fallen or if you need assistance in any way, and it connects you to a health center or a care partner. And then on the bottom right is just essentially a television. It's an example of very basic technologies and the ways in which they can be helpful for us in different ways. In this time of quarantine, I'm sure many of us are guilty of binging Netflix, which is totally acceptable as far as I'm concerned. But that's just one way in which technology actually serves a purpose. And for some of us, it may act as a way to support our brain health in different ways. And that's just a big umbrella of possible devices that we use in our day-to-day. I have three more examples for you. On the left-hand side is sort of a health website. We know from research that approximately 80% of adults go online to look for information about a specific condition or a specific health issue. This is a behavior that's completely normal. It's very normal, especially when we're looking at scarce health resources, or right now with the distancing, we may want to go to the web as a first step. So absolutely a normal behavior that many people engage in. In the middle is a mobile app. I believe this one's called Headspace, to manage mental health. And so there's a lot of apps out there. We're gonna look over a few examples later on as well that can help us with a wide range of habits that we may want to develop, or tracking and monitoring. So there's really a lot of options. And there's also some solutions that are much less popular, either because they're expensive or for other reasons. And these include various forms of robotics or social robotics, which we're particularly interested in the lab. On the right-hand side, this is Pepper. You may have encountered Pepper. He's a popular guy, and he's available for interacting with at some airports, I've noticed. The airport, the Toronto airport in particular. So I guess his career in healthcare is maybe on the rocks, but Pepper is a widely used, widely studied social robot. There's a lot of other examples out there And again, those robots are developed in some cases with health applications in mind or with well-being applications in mind, and they can be used to support our brain health in a number of different ways, which we'll cover. So what can all these gizmos and gadgets do for us? Well, they can have a wide range of possible application areas for our day-to-day life. I've mentioned Netflix as a form of entertainment and distraction, and that's very much the case. We enjoy our phone games and our TV shows, and that's perfectly normal. And in some cases, it can be essential. Distraction or other forms of entertainment can lower agitation, they can lower stress. So I always joke with my team about this one particular phone game that I'm completely addicted to, but in some cases, it serves a very useful purpose. These technologies can help us with activities of daily living. They can guide us through carrying out a recipe. They can help us remember to brush our teeth thoroughly, wash our hands. So there's a lot of different things that they can help us with. They can also help us with physical activity, and that's a little bit counterintuitive, especially when my examples revolve around television and Netflix and all of that. But in a way, they can be very effective in promoting physical activity. Fitbit, again, is an example of that. It sort of helps you track your steps and you get a sense of whether you're meeting your goals, and it might sometimes act as a bit of an incentive or a nudge to get out there and finish your 8,000 or 10,000 steps. In some cases, social robots such as Pepper are used to demonstrate physical therapy exercises. They've been used successfully in that context before, so you can see it as your own sort of personal therapist in your home. To not only remind you to do your exercises, which I'm sure many of us could benefit from, but also demonstrate how to do them well. Some assistive technologies function as a way to compensate for sensory, physical, or physiological limitations. Hearing aids is a perfect example of that, help promote participation in other activities. Some technologies can help us with social contact and social interaction. And again, this is a bit counterintuitive. We always think, oh, the kids in the bus, you know, when you take the bus and every person is on their phone and not looking around and not talking to others. And it seems like technology is more isolating than connecting, but in a way, probably all of these people are actually texting their friends or their family or in contact with them in other ways. And so, especially in this period of social isolation, we found that technology actually could be a very useful tool to connect us with our loved ones, with our colleagues, with our friends. And I think for some of us, we're all very tired of Zoom meetings, but they're better than not having these get-togethers in the first place. So that's been another application area. And then they can be used as health interventions or as health monitoring and tracking in different ways. There's different interventions that are available that are sort of recommended by physicians that you can do on your phone or online. Not all of them are recommended though, and we'll go into a little bit more detail about that. But there's different ways in which technology can really help with our health. Again, at this time of pandemic, we're discovering new ways in which technology can be used in the process of delivering medication, for example, or again, in fostering social connections. So there's a lot of new emerging application areas for a broad range of technologies that we're interested in studying and developing. So I think I've alluded to a lot of potential benefits of these technologies. There's a lot of good things that can come from using them. It's hard to study all technologies as a group because a hearing aid and a social robot and a mobile phone are of course very different, and they all have their different application areas and their different benefits and also different harms, which we'll get into as well. But if I take social robots as one example, I can share with you some of what research has found in terms of how they're beneficial to their end users. And in terms of potential impact, we've found that they're useful in decreasing agitation, decreasing anxiety, loneliness, and stress, which is all sounds very good to me. They've all been also been found to increase quality of life, engagement, communication skills, and activities of daily living. And these impacts have been found all across the lifespan, from children, their families, all the way to older adults and persons living with dementia and their care partners. So there's a lot of potential benefit. As you can see, this is just data around social robotics, but a lot of these benefits translate to different technologies in the different ways that they enable us to participate fully in activities around us, connect with others, and maintain our own health and well-being. So if assistive technologies are so amazing and they have all these benefits, and boy, wouldn't we want to have less anxiety and be healthy and all of that, then how come more people aren't using them? So there's not a lot of people who use social robots. There's certainly a lot of people with phones, but maybe are not aware or using those devices to their fullest. And we're very interested in what sort of prevents people from really getting the most benefit out of these solutions that are out there already today, and that can help in various ways. And so when we ask people, why wouldn't you, get a robot, or why wouldn't you get the smart home system that can help you in this way or this other way? We hear a lot of different reasons, and these are just some of them. And I want to preface this by saying that all of these reasons are very valid, and that there's no right or wrong reason to adopt a technology. And so with that said, some of the things that we hear in terms of why people don't use assistive technologies, some people tell us, well, they didn't know they existed. Very fair. We don't always necessarily know about every potential solution that's out there. Some participants tell us they don't need it. They don't need a robot friend. They don't need something to track their sleep. They're fine. They're fine with their half-hour walk. They don't need to know exactly how many steps that was. And that's also a very valid reason to limit your use of technology. Some participants tell us they're too expensive. Very true, especially for the very sort of fancy technologies out there, the robots and such. They can have a very high cost, so again, a very valid reason. Some participants tell us they worry about their privacy or other ethical issues. This is also a valid reason. All of these, as I mentioned, are very valid reasons. There's a lot of potential ethical issues that can arise from using a technology, a lot of benefits, but also ways in which we can be harmed. And so being concerned about that is natural. And then some participants tell us they think it would feel awkward. They don't really want to have a conversation with a robot, and they feel like maybe petting a fake dog would be weird, or they don't really just they feel maybe other people would judge them if they used a certain technology. And that's, again, something that we hear a lot, something that has definitely some truth to it, and we definitely are working towards finding solutions for all of these reasons. So in scientific terms, these reasons that people give us when we ask about assistive technologies, they're called barriers to technology adoption. So essentially challenges that prevent people from adopting a technology and from getting the most benefit out of it. And I want to go over a little bit of research around 4 of these barriers to adoption. All 4 were represented in that previous slide, but we're going to start with benefit. So the idea that technology should benefit older adults, persons living with dementia, caregivers, is important. And essentially what we're finding out is that we don't have a good sense of what is a benefit. It's important. So the benefit is the person who says, I don't need this. I'm fine. I'm fine without the fancy robot or the sleep tracker. So these individuals are not seeing the potential benefit. And if they were to use the technology, they may not derive a benefit that's meaningful to them. So together with a wonderful master's trainee in my lab named Katarzyna, we conducted a very brief engagement activity at this very conference last year, where we had a workshop with a range of participants, and we asked them about what robots should or shouldn't do. And we gave them examples of different activities that robots could help with. We invited different groups to add their own thoughts about different activities that robots could help with. And then we asked them, of these activities, which ones do you think robots should help with? And so what we found is that when it comes to benefit, we don't even agree on the activities that we want help with that would lead to a benefit, with some exceptions. Everybody agreed that robots should do the house cleaning. Personally, I 100% am in support of that. We have a Roomba in my home, and it's the only reason that the floors are clean. So definitely there's good agreement around that, and I think that there's technology being developed to address that need on an ongoing basis. Other categories of activities, there was pretty good consensus, although not perfect. So things like shopping and meal prep and helping with communication and fostering human-to-human interactions And there was pretty good agreement that robots also should help with that. Where there was much less agreement was with activities like dressing and grooming, feeding, and of course bathing. You can imagine these are a little bit more intimate activities. They're a little bit more sensitive. And there was a much greater disagreement about how people felt about whether robots should help with these activities or not. So if we, as an end user community, don't agree on what robots should do, it's very difficult to make a robot device that's going to please the majority of people. And so we need to address this problem by engaging the eventual users of the technology in the development of the technology itself. And we'll get to that in just a moment. The second barrier that I want to cover with you is the barrier around accessibility. And we talked about how much a device costs, right? You remember my slide with the various reasons. People say, well, it's too expensive. For sure, that's one possible accessibility issue. There's other issues, just getting your hands on something, just finding, Best Buy doesn't carry Pepper. So it can be a little bit difficult to get your hands on some of these devices. But there's other ways in which technology is not made accessible to various communities. And I want to give you one example of that through our own research. So this is a snapshot. You can't see what's on the image, but that's okay. This is a snapshot of a web page about dementia. And a couple of years ago, we did a study of about 300 web pages about the prevention of dementia. So if you were interested in preventing dementia and you went on Google and you punched in some keywords, you're going to get a lot of results. And so we were very interested in measuring the quality of these resources, which we did as a separate study, but also their readability, which is the data that I'm showing you here. So we essentially wanted to know how hard is this information to read. So we used a formula to calculate that, which is called a readability index. And on the right-hand side, you can see our findings. We looked at information about treatment, we looked at information about overview of dementia, about symptoms, and about all of these categories combined. And what we found is that all of the websites scored much too high on the readability index, so very, very difficult to read. And that line, that orange line that you can see on the slide, that's the level that the readability should be at. So that's between 6 and 8 grade score, so 6 and 8 years of education to understand the content fully. And what we found is that only 3% of the 300 web pages that we looked at was at a reading level that matches the recommended level by the American Medical Association. So essentially what that means is that most e-health resources about dementia out there are too difficult to read for the average person. I don't mean by that they're not going to be able to actually read the words. We can read the words. Anybody can, most people can read the words without too much trouble, but it's very difficult to meaningfully interpret how to make sense of that information in a way that's sort of easy and approachable. So that's an issue of accessibility. We have the technology solutions out there, but they're difficult to really get the full benefit from these resources because we're not able to access the information in a way that's very meaningful to us. So moving forward to the third barrier to adoption, that's the idea of ethics. So my example from earlier was the participant who said they were concerned about their privacy. Again, that's a valid concern. There's a range of other ethical issues that come into play when deciding to use technology. Excuse me. And one example of that, I think that really encapsulates a lot of ethical issues is from a study we did a few years ago now that looked at online tests for dementia. So we looked at the tests that are freely accessible, that you can go again on Google and look up free memory test kind of thing. And we looked at what would happen, what would you find, and what were those tests like. So we conducted a study around that. On the top part of the slide, you can see the title from our scientific manuscript, and then on the bottom is the news media picked up this story, and we got quite a bit of press coverage, which was excellent to get the word out. But essentially what we found is that all of the tests that we studied were essentially no good. They were not the kinds of quality that would lead to meaningful information. So for example, they would be very different than what would be tested in the clinic. They had issues with privacy, so they would share data with third parties, those kinds of things. Excuse me, some of the tests had clear conflicts of interest, so they had a test that supposedly would give you information about your memory, but really they were just trying to sell you unproven supplements. And some of the websites were just plain fraudulent and predatory, and were just really trying to get at some data without providing any value. So this is a huge problem, and we don't want to engage with technology that's potentially harmful on those levels. I should mention that study took place already a few years ago, and several different and new solutions have come on the market since, some of which have been validated in health research environments and are being recommended for use through your physician's recommendations or through your healthcare provider. And so I don't want to paint every technology with the same brush, but I think it's important to know that we uncovered some serious issues with what's out there. So it's important to be informed when you're choosing which solution you're going to use. And in the second half of this presentation, I'm going to give you 10 questions to think about when you're considering using a technology like this. So finally, our fourth barrier to technology adoption that I will discuss today, I should mention this is four of many, but the last one that I want to spend a little bit of time on with you is around emotion. And that's a little bit counterintuitive as well. I think a lot of people, sort of when I raise the issue of emotion with technology, I get a lot of questions about whether it's even appropriate to fall in love with a robot, and I'm sort of trying to think that's not the kind of alignment that I'm talking about here. But certainly there's an appropriate amount of emotion to experience when engaging with the technology, and that's something that's a huge interest of us in the lab. So we're trying to really investigate that question carefully. And so when it comes to emotional alignment with the technology, there's different ways in which it can be done, and we know of several successes and failures in that realm. And I want to share with you 3 examples from the past, all of these now from the past. So on the left-hand side on the slide is Clippy. And some of you may be familiar with Clippy. He was a virtual assistant, so the little paperclip guy. He was a virtual assistant in the program Microsoft Word. And this was already a while back, and I'm dating myself certainly here. But he would sit in the corner of the screen, and if you encountered some issues or you needed help with the program, the little avatar would sort of engage with you and say, well, what do you need help with, and that sort of thing. And for those of you who use Microsoft Word, you probably know there are some tasks that are hard to carry out using Microsoft Word, or frustrating, I should say. And for example, if you were trying to include an image in a document or include a big table in a document, and then all of a sudden everything goes out of whack and it's a terrible disaster. This is not usually a time when you're in a super great mood. And I can tell you, when I was writing my PhD thesis, there's so many of these problems that would take place, and you would just end up getting so frustrated. So at a time when you need your virtual assistant to sort of help you out, you're very frustrated and pretty much ready to throw the computer out the window. And there's Clippy in the corner, and he's dancing and he's winking at you, and he's got this big smile, and he says, how can I help you? And this is a really fundamental mismatch between the emotion of the end user at the time when it needs assistance from the virtual assistant and the emotion being displayed and recognized by the virtual assistant. So not surprisingly, Clippy didn't do very well as a virtual assistant, and he got the axe not too long down the road because people really disliked this avatar. And it's a little bit of a fairy tale in affective computing, but there's some thought that this complete mismatch between how you're feeling when you need the assistant and how the assistant is making you feel was a huge problem in the success of this solution. In the middle is the robot Casper. Casper is under investigation in part at the University of Toronto, or by some researchers at the University of Toronto. And for Casper, they're trying to improve on how Casper understands and responds to emotion by having some lights in Casper's mouth and eyebrows. And by changing how those lights are being activated and in what shape, they can have Casper convey and respond to emotion in that way. So already we have a sense that we're trying to not just display positive emotion at all times, we're trying to be a little bit more responsive to the end user. And then finally on the side is the robot Cosmo, which was a very short-lived experiment. but it was a very interesting solution. Cosmo has eyes that are animated by Pixar animators or Pixar artists. And in that, they were very successful in having Cosmo express a variety of very specific emotions like frustration or jealousy. And that was very impressive. And if you've seen a Pixar movie, you know how good those animations are. So using that artistry in a robot was actually a really nice touch. And Cosmo was very successful in that aspect of the delivery of his application areas. So he was very emotionally expressive. Now, I've talked about how all three of these examples display emotion, but I haven't talked a lot about how they respond to emotion. And that's very important, as we've uncovered in a study that we did. So I've mentioned a little bit earlier that we were interested in looking at online tests for dementia and whether they were of good quality and ethical. And so in following up to that study, we were interested in the experience of these tests in the clinic. So there are, and there were at the time, some tests that were validated for use in the clinic. So they weren't free for you to do at home, but if you went to the clinic, you may be asked to do this computerized memory test right there on the spot. So we did a whole study around that, and I don't want to spend a lot of time going over all the details, but what I do want to share with you is that we've heard our participants in this study tell us various things about this test. They told us things like the test was boring, or they didn't understand what the test was for. But in reaction to the test, they also experienced a range of emotions. Our participants told us that they felt lost, that they felt bombarded, that they experienced some self-blame. They said they should have done better, they should have, they should have prepared better, which is definitely not something we want. That they were feeling anxious around taking the test. And this is really, what we're hearing is that people are experiencing negative emotions, that the test is not making people feel good. Test taking rarely makes people feel good. But in this instance, this is a health technology. We don't want people to engage with the health technology and then go home feeling anxious. That is not the end result that we're interested in here. So that study really shed light on the potential emotional impact of these technologies and on the need to do better. We need to develop technologies that, without necessarily looking into falling in love with a robot or being in love with your phone, that have some amount of responsiveness to who we are as humans and how we must interact with the technology to derive the maximum benefit. You can imagine that if this was a test at home that you do at home, and you're meant to do it every month, and you do it one time, you come out of it feeling lost and bombarded and blaming yourself for not preparing enough, you're probably not going to do it again the next month. And so if we want people to really benefit from some of these technologies, we need to design them in a way where people are feeling emotionally positive as a result of using the technology. So some of the studies that we're doing are looking at this relationship between the human and the technology. And traditionally, I can tell you that as humans, we have various emotional states in which we use technology. Maybe we're having a super good day and we're meeting with a friend later and we're very much looking forward to that. And so we're trying to put in this figure in the Word document because we're just wrapping up some work in the morning and we're trying to put something in and it's not working. It doesn't matter. The sun is shining. You're meeting up with your buddy. So you just close the computer and figure, I'll take care of this later. It doesn't matter. Everything is fine. Some days we're really not having a good day. Earlier this week, when we did a test run for this webinar, I was really not having a good day. I had a lot of meetings. I was very tight for time. I was behind on a million things. And we were trying to get the platform to work. And for many reasons, most of which were my fault, it wasn't working. And so that was a very different experience with the technology. You know, if I let loose, I probably would have banged on the keyboard. I was ready to just throw the whole thing out the window. So our personal emotional state varies a lot. Some days we're good, some days we're not so good, some days we're stressed, some days we're tired. But the technology doesn't care. It's not going to make things easier for us because we're frustrated that day, and it's not going to be more fun and engaging if we're feeling good. It doesn't respond. It just does its thing, often does its thing poorly, but it doesn't engage with us on an emotional level. And we're trying to change that because we think if we can develop technology that is a little bit better responsive to how we're doing, we're going to be able to develop solutions that people are going to want to continue to use. If the technology is able to tell you you're feeling anxious today, so maybe it's not the right time to do a test about your memory, come back tomorrow when you've slept well. I think we'll have better success in getting people to really get the benefits from these different solutions. So we're trying to reverse this relationship. We're trying to analyze how we can make technology, virtual assistants like Clippy, social robots like Pepper, how we're trying to make them understand how we're feeling that day and respond accordingly. And we're doing that through modeling, through artificial intelligence, using a paradigm called affect control theory, which is abbreviated ACT. And we're really working to make solutions that are going to be just the right amount of emotional, not so much that we become dependent or become overly attached, but enough that we don't ever want to throw these things out the window. So to summarize this first portion of the talk, we've looked at a lot of different reasons why people don't adopt technology, and I think we need to address all of these barriers as we move forward. And we're working on addressing these in the lab using a wide range of methods in order to improve benefit, in order to develop and research technologies that are going to have a positive impact for a majority of people. We need to create them with the end users. We need to hear from you, from your needs, your priorities, and develop these technologies through a process of co-creation. Because it turns out engineers, computer scientists, and health researchers are not that good at guessing what the problems are. We've not been that good. So we need to hear directly from the people who need these technologies and who would most benefit from them. In terms of accessibility, of course, price needs to come down for some solutions, but we also need to improve how we interact, how easy the technologies are to use. And we're borrowing from engineering in the robot realm, certainly by using human robotics interaction methods, trying to really get a better feel for how people are interacting with these devices and how we can make it more intuitive, easier, and more sustainable over the long term. In terms of addressing the various ethical issues that arise, we're trying to, again, similar to the benefit, we're trying to consult heavily with our end users, trying to understand which ethical issues are an absolute showstopper, and which we can come up with solutions to address in a collaborative way. And so again, there's ways around a lot of the issues that we're encountering. We just need to hear from the end users what is most acceptable to them, what makes sense, and what would promote technology use and benefit. And then again, for emotional alignment, I've just mentioned we're interested in doing some modeling and better understanding how people respond emotionally, and how we can develop technologies that find that sweet spot of responsiveness to human emotion. So for the last few minutes of my talk, I want to end with an infographic that we've developed, and I say we, but I mean mostly Julia Wu in my lab, who's done a fantastic job of developing this based on some research that we conducted together, where we're putting forward 10 questions for older adults who are considering adopting a new technology. And the infographic looks like this. We're going to go over every question, but it will be made available to you after the talk is over. So right now, I just want to go through each of the questions before I open it up to questions from you. So the first question to ask is, will this device improve my quality of life? Very simple. We're all looking to have more fun, to be more productive, to engage in activities that are more rewarding. Is this a technology that's going to support you in those goals and do so over the long term? So that's always what I recommend we think about first, is this going to make my life better, essentially. Then immediately after asking if this is going to make your life better, ask yourself, is this also going to make everyone around me's life better or worse? And so we're always very interested in making sure that the device also benefits somebody else in your care circle, in your family circle, maybe your spouse, maybe your care partner, maybe someone who lives under the same roof as you. Having someone else who benefits from the technology makes it much more likely that the benefit that you'll both experience will last a long time. So we definitely want to look at, is this something that my spouse is going to be very annoyed with all the time when I turn it on, or is this something that's going to really help them and help me feel safer or feel more engaged or connect with the grandkids or whatever the case may be. So I should mention these 10 questions, they apply to any technology, whether you're thinking about joining Facebook or downloading a new meditation app, or buying a robot. Any technology, these 10 questions apply. So the third question is kind of an obvious one, but important to remember to look into ahead of time, is how much does this device cost to buy, but also to use. So some of the devices have hidden costs. Sometimes it's a monthly fee. And a very popular model right now is the free trial. So you sign up for a free trial, and then you use the app twice, and then 3 months down the road, you've never used it again, but then you have this mystery charge on your credit card. So those are the kinds of things that is important to look at ahead of time. Make sure there's no surprises down the road. Another question to ask is, am I confident I'll be able to use this device easily? So is it intuitive? Does it look like it's pretty clear? Do I know someone who is also using this device? And if I run into trouble, is it very clear who I can go to for help? Is there a clear phone number, email, chat attendant, something like that? This is very important, because if we're not able to easily engage with a device, we have so many choices when it comes to technology. It's very important that we pick the ones that we're going to be able to use for the longer term. Again, having someone in your circle who uses a similar technology or the same device often is very, very helpful. Another question to ask is, do I understand all the potential benefits and harms of using this device? We've talked a lot in this presentation already about potential benefits, social connectedness, medication reminders, tracking your sleep, monitoring your cognitive health, your memory, all of that potential benefits. But there's also some drawbacks. We talked about issues with privacy. We talked about things like annoying your spouse. So harms come in a wide range of importance. But do you get a sense of what potential harms you may encounter? And I have 2 examples in the form of additional questions for you. So the first potential harm to think about is, of course, is your information being kept private and protected? In an ideal world, we would read through the 48 pages of terms and conditions and privacy policies, phone up our friend who's a lawyer, have them explain all of that in language we can understand. But in the real world, we often don't have the time, the motivation, or the resources to do so. So trying to see if there's other ways in which you can tell how your private information is being dealt with. Are they being transparent when you sign up about what's going to happen to your information? Usually, this is not a golden rule, but usually companies that do a great job with your personal information also do a great job of telling you what they're doing with it. So if the agreement is clear and brief, and you can make sense of that by yourself, so that's usually a good sign, but not a for sure sign. Another question to ask is, do I trust that this device is of good quality? So in this age of online shopping, and quarantine has definitely been an incentive for online shopping, we've lost a lot of the different ways in which we would previously determine whether something we purchased is of good quality. You can buy something at a dollar store, and you can buy the same item at the Apple store, and you know, because you walked into a dollar store, or because you walked into the Apple store or Best Buy or whatever, you know, based on your experience with these different outfitters, what quality you can expect. Similarly, in the store, you can touch the object, you can talk to a salesperson. You have a lot of indicators about the quality of the product. But now everything is on Amazon. You just click, buy now, and 2 days later it shows up at your door. We don't have the same tools to evaluate device quality. Once we get it, we often can tell. I bought a coffee grinder recently, and as soon as I had it in my hands, I knew this is going to break on the second try. So once we have it, we can tell. But when it's time to decide and to pick the technology, we don't have these tools for us to determine the quality. So again, this is where it helps to know someone who's used it. Look at reviews, understanding that, of course, reviews are not a perfect system, and people can certainly review their own products. But we need to find other ways in which we can determine whether something is going to be of good quality or not, and internally to a good benefit. Another question to ask is this going to support your independence? I like to supplement that question with, is this going to support your independence or create a dependence? I can tell you there's some games on my phone that are definitely the latter. So you need to think ahead of time, again, know yourself, and try to figure out, is this going to improve your feelings of safety? Is this going to improve your well-being, your ability to go about your life independently and confidently, or is it going to do the opposite? Is this something you have to charge every hour? Is this something that's going to break and you're going to have to replace it, or else you're going to have a huge gap? So think about those kinds of considerations. And then I see that I'm running low on time, but I'm almost done. So 2 more questions. One is another one that I really invite people to think about is, how is this device going to impact my levels of stress and anxiety? And I think in particular of things like social media applications or the brain training games. Some people really thrive and they really enjoy those kinds of things, and other people don't. And so it comes to knowing yourself and those kinds of platforms and devices, they're great when you're feeling good. Brain training that shows you a graph of your performance, they're great when your performance is improving and when you're doing better and you're getting better at the game. Similarly, Facebook is great when you're feeling good about yourself and you share about all the great things you're up to. But if you're someone who's very stressed out about your well-being or your mental health, or you wish you maybe were experiencing different things in that time, think about how these devices or these solutions or these apps are going to impact your stress and anxiety, and know yourself. And if you know, yeah, this might be fun for a bit, but in 3 weeks, maybe I might not enjoy it as much, then just sort of save yourself the trouble. Similarly, some apps, maybe you get a meditation app and it reminds you to meditate every day at 3, but some days you just can't at that time, and the notification is dinging on your phone and it's telling you meditate. Are you gonna be able to respond to that in a way that's positive and enhances your well-being, or is that just gonna be a source of stress? So very important to know ourselves in that sense. And then finally, my last question, is this device aligned with your values? Again, know yourself. Some people, for example, if you're thinking about purchasing a smart home environment, some people really thrive on all that automation and having the coffee maker start before you wake up, and having all these devices and being sort of with the latest technology. And some people don't look for that. Some people want a quiet home environment. They want the pleasure of walking to the coffee maker and choosing their coffee and doing all that sort of thing. So, and both of these approaches are 100% valid. It's really a matter of knowing yourself when you're making that decision. So my last slide, if any of this is resonating with you, if you're interested in learning more, if you want to participate in the kinds of research that I've talked about, or if you just want to know more, I invite you to consider joining our research advisors group, the League. And if that's at all something that you might be interested in, my email is right there, so feel free to be in touch. And I'll put you in touch with an outstanding trainee in my lab, Mallory, who's been overseeing our group of advisors and who is absolutely terrific. So
thanks, Julie. Thanks, Julie. That was an amazing presentation. And as I said earlier, I always learn something new, and I love the way that you have such practical tools interwoven into the presentation. The last 10 questions were excellent. I think we do have some time for questions. And as I mentioned before, you're welcome to use either the raising your hand or post into the chat. Christine will help us with that. And just a reminder as well that the presentation is being recorded, so questions and answers will be recorded and available on the website in a few days.
Yolanta, there you go.
I wanted to ask you if the use of the smartphone, they have some radiations on our brain. They produce some radiations, the smartphone.
Yeah, I don't think that's something that we need to worry about all that much at the moment. Yeah, I mean, unless you were someone who were sort of talking on the phone with the phone next to you for 15 hours a day, it's really not something that you need to worry about.
Mm-hmm. Thank you. Thank you.
And I do see a comment here. You have at least one candidate to get involved in your research. So you can expect to be hearing from someone after the fact.
Yes, just a quick question. How can we influence the government to make this available through our medical system, considering the cost of this robotics or equipment involved? Thank you.
Thank you, Mario. That's an absolute, that's an excellent question, which was how do we influence government to make sure that these devices end up in the hands of those who need them most in a way that's covered? And I think the answer is by having strong evidence of their benefits. And so I'm a researcher, I'm going to call for more research, but I think we need to have really good evidence about the ways in which people are helped with these devices, and that holds for devices, but also for services and programs. We need to show the evidence that people are benefiting from them, and from there we can expect a policy to change. But it is a very slow road, and for some devices, we already have a lot of good evidence showing benefit. The obvious example is hearing aids, but for some devices, like the social robots, they're fairly new still. There's early days, and so the research is just not that compelling yet to convince them to cover the thousands of dollars that they cost. So I'm hopeful that with more research and a bit of time, we'll get there.
Okay, we've got something coming up here. It seems that the 10 questions should be asked when considering each device.
Yes, that's what I would recommend. It is a lot. I mean, it's a lot to ask for every app that we download. But I think just a quick run through of making sure, how does this align with what I need and what my values are every time you're about to engage with a new technology is helpful. Reviewing how much it costs, I think, is very important. Quickly getting a sense of what happens to your information that you're going to enter through the use of the device, or that is going to be collected through the use of the device. So yes, I would say for every technology that you consider using, you should, whether consciously or sometimes slightly subconsciously, ask yourself how this fits into your life and how it will benefit you and potentially harm you, and then weigh those things to make the decision.
Just again, Julie, just a huge thank you for your presentation today. And just reflecting back at the beginning of the first series, when we had Dr. Lillian Hung talking about some of the technology in her presentation, and then yours today, it's been a real interesting just learning about the differences of uses of technology and how that can really improve the quality of life for people who are aging, older adults, and people living with dementia. And a big thank you to all of you who've joined us through the series, this first time virtual dialogue on aging by Providence Healthcare. I think it's gone very, very well. And I really have to applaud the Providence Healthcare team who, despite the uncertainty of COVID, stepped up to the plate with some creative ideas and brought this together. And I think it's been a great forum. And I know many of you have joined us for all 3 sessions, so thank you for that. As I mentioned earlier, the sessions are recorded and will be on the website in a few days, so you're certainly welcome to go back and reflect and listen, and certainly as well the email contacts for our 3 presenters will be available as well. So again, thank you so much for your time, and the Alzheimer's Society of BC is so proud to be a partner with Providence Healthcare. And I'm going to say, see you next time. I don't know how that will be, whether it will be an in-person see you or a virtual see you, but I know we will see you again soon. So in the words of Dr. Bonnie Henry, be kind, be calm, and be safe. And thank you, and have a great Canada Day.